My Lords, I'm rising to move Amendment 61, which is calling for a review into the causes and consequences of the huge spike of diagnosis of mental disorders, and it should also investigate the impact of this on the availability of services that we envisage treating those people with a mental disorder that this bill seeks to help. If in our best efforts to provide alternatives to detention for the severely ill, we hope to ensure that adequate care in community settings exists, surely we must look at the phenomena that threatens to squeeze out those who most need access to such services. Implicit to this endeavour is to ask if inadvertently some aspects of policy set in train a self-fulfilling prophecy, rebranding any deviation from the norm or troublesome behaviour or anxiety, or even, according to the government's own curriculum review, GCSE exam stress, under the therapeutic language of mental health, has consequences. As Tony Blair has noted recently, you've got to be careful encouraging people to think they've got some sort of condition rather than simply confronting the challenges of life. Yet the young especially are prone to internalise the narrative of medicalised explanation and adopt an identity of mental fragility and illness. And this can create a cohort of citizens demanding official diagnosis, NHS intervention and treatment. This week, the media has featured the new book by Dr. Alistair Sandhouse, a neuropsychiatrist from Maudsley Hospital. In the book, No More Normal, Mental Health in the Age of Overdiagnosis, Dr. Sandhouse argues, quote, "It's become crucial to reassess what constitutes mental illness so that we can decide who needs to be treated with limited resources and who can be helped in other ways." He worries the NHS has, quote, "buckled under the tsunami of referrals," and other state services are straining to the point of dysfunction as well, we should note, because despite the fact that the number of children with education, health and care plans has more than doubled in less than 10 years, still parents are desperately complaining about waiting for years for autism and other assessments. In other words, the demand is just galloping. And all this is leading to at least 18 councils at risk of insolvency, according to The Guardian on Monday. Also, the present row over PIPs and welfare system collapsing under the cost of ever greater numbers claiming disability payments for mental disorders is now a major political issue. And indeed, I've been partly inspired to table this amendment by the Health Secretary, Wes Streeting's concern about overdiagnosis of working-age adults and leading them to be written off, as he said. And it's especially tragic that this is happening overwhelmingly amongst young people. My concern and the point of this amendment is that this can skew NHS provision. A Savanta poll of 1,001 GPs for the Centre for Social Justice's report, Change of Prescription, reported that 4 in 5, 84% of GPs, themselves believe that the ups and downs of normal life are now wrongly being redefined by society as mental disorders. And 83% of those GPs now believe that antidepressants are too easily prescribed to patients. Yet they, the GPs, are under so much pressure from patients demanding treatment that they prescribe them. Similarly, in 2013 and 14, just 1,800 adults were prescribed drugs for ADHD, but last year 150,000 adults were prescribed with ADHD medication. And waiting lists just keep growing and lots of anger continues. When I last spoke on this topic in this mental health bill debate, the media picked up on it and I was inundated with emails largely from people furious with me for challenging overdiagnosis. If you want, I had a tsunami of hate mail. There was even a formal complaint sent to the Standards Committee of the House. People said, and I understood it, how can you say there's an issue of overdiagnosis when I can't get a referral for myself, for my child, and so on? And it is true that a GP cannot formally diagnose ADHD as it requires specialist assessment. So now the average waiting list for ADHD referral on the NHS is 3 years. But this lack of formal diagnosis isn't necessarily stopping service provision becoming overwhelmed and distorted. And I think This mood is going to have a very damaging impact on what we want this bill to do. I just want to finish with an apocryphal tale from Oxford University's disability report from 2022 to 23. It reveals that the university has, under pressure from students, agreed to, quote, accept a wider range of disability evidence as a key to giving 25% more time in exams and the use of computers in exams. The university's explanation is telling. They talk of a, quote, wider context of extensive and ever-growing waiting times for ADHD and autism diagnostic assessments. And so they say, we are aiming to reduce administrative burdens and barriers for disabled students. The parallel for us in relation to this bill is the hard-fought-for arrangements for the disabled at university are now potentially being corrupted by an over-demand and by demands for diagnosis, and diagnosis itself is now being conflated with supporting documentation. So it's enough for those students to be on a GP's waiting list for formal assessment to be treated as though they're disabled. Hopefully, my lords can see the dangers of such trends off campus for this bill here. My personal worries are about the culture of draining society of resilience and of a dependent citizenry. But for this mental health bill, it would just seem sensible that the government reviews the confusion about who services are for and what is driving this extraordinary increase in those demanding NHS, mental health and autism services. Because it seems to me it's not social, it's social rather than medical. But whatever is happening, it could mean that those most in need will be neglected in this scramble for official labels and treatments. So some reassurance from the Minister at the dispatch box that this will be looked at rather than overlooked would make me feel that this is not a major, this major social phenomena is not going to be swept under the carpet, because I think it will impact on negatively the implementation of this bill.
Before the lady, no, the lady
yes.
sits down.